In this video, I will go over different forms of polycythemia. So with relative polycythemia, due to decrease in the volume of the plasma, which could be from, for instance, burns, from dehydration, or from excess use of the diuretic medications, which causes loss of the plasma volume, these patients present with elevated red blood cell count, elevated hemoglobin, elevated white blood cell, and elevated hematocrit. And then a reverse phenomenon is also existing there called dilution effect. So once you're admitting a patient to the hospital and you start them on the IV fluids, you notice that there's a sudden drop in the hemoglobin as well as the white blood cells. And this is due to the dilution effect of the IV fluids on the blood count in these patients. Next, we have the absolute polycythemia, which is divided into primary and secondary. So primary absolute polycythemia, an example of which is polycythemia vera, which is due to the mutation in the JAK2 gene, and these patients have itching after they take a hot shower. And then the blood count showed elevation of the hemoglobin, hematocrit, platelets, as well as the white blood cell counts. However, the levels of erythropoietin is low in these patients. Now, I would also like to mention that there is this other condition called essential thrombocytosis, which is associated with mutations in JAK2, and this condition is only associated with the elevated number of platelets, but the number of hemoglobins and white blood cell count are normal in these patients, versus polycythemia, which is also associated with mutations in JAK2. The levels of hemoglobin, hematocrit, as well as white blood cell and platelets all are elevated. And then again, I would like to reiterate that the level of erythropoietin is dropping in these patients. The next condition is secondary absolute polycythemia, which is from conditions that cause hypoxia. For instance, patients with COPD, sleep apnea, or congestive heart failure. Since there is not enough delivery of oxygen to the tissues, body will note the decrease in the oxygen and thus will increase the levels of erythropoietin in these patients, which will cause increased levels of red blood cells. And then the other term that is used to describe this condition is also called erythrocytosis. Since only red blood cell count is the one that is increasing in these patients, therefore the polycythemia may not be an appropriate term to use. And so sometimes it's referred to as erythrocytosis for this condition. And then finally, we have inappropriate absolute polycythemia, where ectopic production of the erythropoietin from tumors such as like renal cell carcinoma, hepatocellular carcinoma, or Wilms tumor can cause increased levels of erythropoietin, as a consequence of which there would be elevated levels of red blood cell count. So note that this condition, inappropriate absolute, is not associated with hypoxia. Versus the secondary absolute polycythemia, hypoxia is the reason that causes increased level of erythropoietin in these patients. And that concludes our discussion.